Morning, my name is Ella Ping Song, and I'm a second-year PhD student with Dr. Krista Longto. Thank you to the MITO2i committee for having me today. I'll be presenting my MITO2i project on mitochondrial dysfunction and cognitive improvements in cognitively impaired patients undergoing exercise-primed anodal transcranial direct current stimulation. First of all, some background. Currently, more than 500,000 Canadians are living with dementia, and approximately 60 to 70% of dementia cases are caused by Alzheimer's disease, or AD for short. Dementia is a neurocognitive disorder that describes a progressive cognitive decline that can impact daily functions. Mild cognitive impairment, or MCI, describes a phase between normal aging and AD, where the memory decline has just begun with minimal or no functional deficits. Annually, about 10 to 15% of MCI progresses to AD. In Canada, an estimated annual cost of more than $12 billion is spent on the care of those with dementia. Currently, there are no consistently effective and widespread pharmacological treatments for MCI and mild AD. Aducanumab, the new disease-modifying monoclonal antibody approved in the United States in 2021, also has some controversy over its effectiveness on cognition in its clinical trials. Novel and accessible treatments are thus needed and would be most effective if targeting early disease stages, such as mild AD and MCI, when the cognitive decline has just begun. This brings us to anodal transcranial direct current stimulation, or AtDCS for short. It is a non-invasive, portable, excitatory brain stimulation approach that can lower the neuronal firing threshold. It has been shown to improve cognitive performance in MCI and AD patients, but with variable efficacy. Given that exercise enhances brain network, and AtDCS is suggested to be more effective when applied to active brain circuits, our lab started the study EXPRESS. Exercise as a primer for excitatory stimulation study, where we're investigating the effects of the combined exercise and AtDCS on cognition in MCI or mild AD patients. In AD, mitochondrial dysfunction and oxidative stress can be key contributors to the pathogenesis of the disease. Somatic mitochondrial DNA or mtDNA control region mutations progressively increase with age, but are higher in AD brains and may contribute to AD development. Circulating cell-free mitochondrial DNA, CCF mtDNA for short, refers to the measurable mtRNA fragments that are released due to mitochondrial dysfunction. According to a recent meta-analysis, reduced CCF mtDNA levels are found in some neurological conditions in cerebrospinal fluids. Low levels of CCF mtDNA in early stages of AD may be caused by mitochondrial loss that signify the event of neuronal death. Limited clinical research is available on peripheral CCF mtDNA in MCI or AD population. However, cognitive impairment was associated with peripheral measures of mitochondrial dysfunction in blood mononuclear cells, and peripheral CCF mtDNA has been measured to examine mitochondrial dysfunction in neuropsychiatric disorders such as bipolar disorder. Furthermore, AtDCS has been shown to modulate oxidative stress in preclinical work, which also can lead to mitochondrial dysfunction. Exercise may also exert its known neuroprotective effects, helping to attenuate mitochondrial damage. These findings suggest that CCF mtDNA may be a potential therapeutic biomarker in MCI and mild AD patients undergoing exercise and AtDCS. Hence, my aim for the project would be to investigate the diagnostic, predictive, and monitoring capacity of CCF mtDNA on cognitive response in MCI and mild AD patients undergoing exercise and AtDCS by looking at the association first between CCF mtDNA levels and global cognition as screening, then CCF mtDNA levels as screening and global cognition changes, and finally the changes of CCF mtDNA levels and the changes of global cognition. Multiple linear regression analysis will be used to assess the associations with covariates. A sample size of 55 will detect association with a medium effect size with an 80% power at a significance level of 0.05. So some info about the study design. Express is a 5-week randomized blinded repeated session and parallel design study, recruiting MCI or mild AD patients over 50 years of age who do not have significant neurological conditions or current psychiatric episodes. Eligible participants will be randomized to one of the 3 interventions shown here: exercise with TDCS or exercise with sham TDCS, or treatment as usual with TDCS. The aim of the first 3 weeks will be to gradually increase exercise tolerance until the participants are able to maintain moderate intensity exercise for 30 minutes, 5 days per week. The dose of this exercise will be maintained during the final 2 weeks of the study, in addition to the combined TDCS or sham stimulation. Participants randomized to the treatment as usual group with TDCS will receive written information in accordance with the Canadian Physical Activity Guidelines for older adults, the current standard of care. And then after 3 weeks, TDCS for the same duration. Cognitive assessment and blood biomarkers will be assessed at screening, week 0, which is end of exercise ramp up, and endpoint. Global cognition will be assessed by the Montreal Cognitive Assessment, MOCA, and serum CCF mtDNA levels will be assessed by quantitative polymerase chain reaction from circulating cell DNA purified by commercially available spin columns with the help of Dr. Andreas' lab. So currently, some status about the study. We have 30 completers for Express. The biomarker analysis has not yet been completed. Some quick points about the demographics. Over 50% of the population is male. The mean age of the current sample is around 75. Majority of the sample are MCI compared to mild AD. Our current completers have an average MOCA screening score of 22. 3 comorbidities in average, with cardiovascular risk factor or coronary artery disease in 74% of them. The completers taking 6 concomitant medications, including supplements on average. Here is a flow chart of our current recruitment status. We have 33 out of the 55 target enrolled. We're aiming and hoping to finish patient recruitment in 2023. This proposed project is an interdisciplinary investigation in MCI and mild AD patients involving basic and clinical investigators from different institutions and departments. The combined intervention incorporates scientific idea from exercise physiology and neuroscience psychiatry. Findings from the project may help identify a novel and non-invasive therapeutic biomarker, defining new targets for personalized treatments. We can also clarify the mechanisms of the cognitive response to the combined intervention of exercise and the AtDCS in MCI or mild AD patients. Thus, not only will it enhance our understanding of the mechanistic correlate of this combined intervention, but also the biological processes behind MCI and mild AD, which is a critical time for treatment to slow cognitive decline. I would like to thank everyone noted on the slides here for their support with this specific project on Express. I also gratefully acknowledge the financial support from MITO2i and the Thomas Active Scholar and CIHR. Thank you very much.